Some answers now from a coronavirus local expert. Joined on the phone, Dr. Erika Hamilton, a microbiologist from UMass Amherst. Hello, Dr. Hamilton. Hope you're well today.
I am well. I hope you're well today.
I am. After that weekend we had, I can't complain, and we're glad that you're here because we have some questions that we'd really love to get your perspective on. And the first one goes, what can you tell us about that at-home COVID-19 test that was just approved by the FDA over the weekend? Think it works?
Well, I'm not entirely sure if I'm talking about the same test, but it's actually not a test that was approved by the FDA over the weekend. It is for an at-home sample collection method. So right now, if you have, if you're being tested for COVID, you have to go somewhere and someone sticks a swab far deeper into your nasal cavity than anyone would like to have happen. This is for a very particular company. It's called Laboratory Corporation of America, or LabCorp. They have a molecular test for COVID-19, and they have been allowed by the FDA to have patients do their own sample at home. So that's what the authorization was for from the FDA. It was for a special type of sampling system that a patient can do at home. It wasn't for the actual test itself. And you can't buy these. It depends on what particular type of COVID test your physician or your testing center is used. So you may not be able to use this special at-home kit to collect your own sample.
Okay, it's a very convenient if it ultimately gets to you, but there's some other options as well that sounds like people are going to send you to first. Sounds like as well you need the symptoms too. Okay, so the next question goes, dermatologists continue to see an uptick in rashes, especially with toes. Are these symptoms of the virus itself?
Yes, in some cases they seem to be. In the rashes, it can look like a rash. It can look like a skin infection. It could look like hives. And even some cases like blisters or chicken pox-like lesions. And in many cases, these are forming on extremities like the toes. And what doctors think is happening is that because COVID-19 has the ability to form tiny little clots in your blood vessels, that this is happening in different parts of your body, for example, in your toes, and tiny little clots are formed. This causes an area of inflammation and irritation leading to the rash. This is actually not an unusual thing. There are several different human pathogens that cause rashes throughout the body during the infection process. But yes, these odd rashes seem to be another symptom of coronavirus.
COVID toes. All right, something to look down, folks. Keep an eye on them just in case. You might see that. So the final question goes, what precautions should we be taking if we're going to send our children back to preschool?
If it were me, one of the things that I would be doing is having a conversation with the daycare providers and asking how they are going to work throughout the day to decontaminate as many items as possible. Now, that is very difficult to do. If you've dealt with young children at all, you know that they are very, very hard to keep them and the things that they touch clean. However, there are certain items in a daycare that will be touched very, very often. Tables, dinnerware, bathrooms, sinks. So what will the daycare providers do to make sure that those surfaces get cleaned regularly throughout the day? Will they be able to help your children or your child wash their hands? Again, that's going to be tricky to do. But what will the daycare providers be doing to help kids wash their hands? When your child comes home, make sure that you wash their hands for the 20 seconds. You may want to consider changing their clothes just in case something is on them. Make sure that any utensils for food that they brought with them, if they brought their own lunches, are thoroughly washed. And then monitor your child for any symptoms of not feeling well, and the same thing for anyone in your house. Watch for things like fever and other symptoms of coronavirus.
Very informative, as usual. Dr. Erika Hamilton giving our viewers some peace of mind and some answers to the questions they sent us. We thank you for coming on today. I hope you stay well, and we'll catch up here throughout the week because we're going to keep bringing you insight here from Dr. Erika Hamilton here at 12:30 and other experts as we continue to answer your questions about this ongoing global pandemic.